so I gave a talk which was entitled Leaving No One Behind, Charting a Course Towards Cerebrovascular Health Equity. And the way I framed the talk was around 4 items: show, know, bestow, and grow. And so for show, the idea is to show those inequities and disparities. With know is to really know the community and the social context in which those inequities or disparities occur. And then bestow is to actually bestow interventions that can be shown to be effective and scalable to address those inequities and disparities. And then finally, charting the course to cerebrovascular health equity cannot be done if we don't grow the capacity and the workforce to be able to tackle those inequities and disparities. And so I first went ahead to highlight the current status. You asked about showing the inequities. What are they? Well, when it comes to stroke, we know that, say for the instance in the US, that for over 60 years, there's been a big disparity between the incidence and mortality from stroke in Blacks or African Americans compared to their non-Hispanic white counterparts. But it's not just racial. We also know that there are disparities in terms of gender. We know there are disparities in terms of socioeconomic status. We know that there are disparities in terms of geographic regions. So for instance, in the United States, we know that there are about 10 states in the southeastern part of the US that are termed the stroke belt, where the mortality from stroke is about twice that of the rest of the country. And within that stroke belt, there's an area called the stroke buckle, Georgia, South Carolina, and North Carolina, where the mortality from stroke is up to 4 times higher than the rest of the country. So these are the inequities and disparities we've been aware of for some time. Now, why haven't we narrowed those disparities over the last 50 to 60 years, especially the racial one? Well, the great news is that because of better treatments for stroke, the incidence of stroke and the mortality from stroke has dropped about 25% over the last 2 to 3 decades for everyone. The challenge, though, is that the disparity hasn't changed. So Blacks or African Americans have a benefit, which is great. All other groups have benefited, but that disparity, that difference in outcomes remains the same. And so this is what the talk was about. How do we try and narrow, or if not eliminate, those lingering disparities in stroke? And one area I emphasized was the issue of trying to focus more on the social determinants of cerebrovascular health. And so the social determinants of health are those conditions we're all born into, we live in, we learn in, we work in, we play in, but have a huge influence on health outcomes. And so many times we, especially we providers, we focus much more on the biology, which of course is very, very important. But we are not as keyed in to the issue of these social determinants of health, and in this case, determinants of cerebrovascular health. And in particular, when it comes to racial disparity in stroke, the issue of psychosocial stress. And so psychosocial stress has been shown to be much higher in Blacks or African Americans compared to the non-Hispanic white counterparts, and has been associated with a whole host of untoward health conditions like raised blood pressure and thickening of arterial walls, which potentially could be a contributor to these disparities that we see.